Welcome to the DNA of Things, where we explore how the unique interplay between our genetics, environment, and behaviors shapes who we are in the world we live in. By understanding the power of our DNA individually and collectively, we gain insights into how we can take control of our health, optimize our potential, and transform our lives. Today, we dive deep into this conversation with Vincenzo Fata, clinical director at Gray Matters, a neurofeedback and brain mapping expert who is leading revolutionary treatments for mental health. Vincenzo's story spans over 2 decades, from martial arts to psychology, and today his work focuses on personalized care using cutting-edge brain mapping and neurofeedback to treat conditions like ADHD, anxiety, and autism. Throughout this episode, we'll explore how science can help us break free from the limitations of labels, diagnoses, and empower us to see each person as a unique individual. You'll leave with a greater understanding of the transformative role of neurofeedback, the importance of personalized mental health care, why hope is always part of the journey. Vincenzo Fata, welcome to the DNA of Things.
Thank you, sir.
I can tell we're going to have a stimulating conversation based on previous conversations that we've had. I think that, your background as it relates to psychology, behavioral change, I think, neurology and neuroscience as a whole, like the work that you guys are doing at Gray Matters is really revolutionary stuff. And, I look at your background in education, over 2 decades, really trying to help bring up the next generation and probably getting exposure to, I guess what you'd call the, neurodiversity of how children are showing up, the readiness to learn, different teaching pedagogies that you've had to pull from to, activate that learning. And then of course there's the counseling that you do at Gray Matters today, which seems to me to be, very revolutionary in terms of, combining, the science that we have today in terms of imagery, but with also, other factors, environmental, medical. And I believe what I remember from remembering your website, one of the things I read there is that this is a convergent space where practitioners converge to help patient outcomes. So I really want to make sure we spend a good amount of time talking about these, groundbreaking practices that you guys are revolutionizing there at Gray Matters. Given that mental health is such a important issue, always has been, but there's definitely a magnifying glass put on it these days. But I'll leave you to point to the statistics. But before we dive into like philosophy and treatment, maybe you can paint a bit of a picture for me, for the listeners, to insofar as your journey into this space that we're calling neurofeedback and education.
Absolutely. So I began my career in education roughly 20 years ago. My initial goal, I had always loved teaching. As a youngster, I really loved teaching. I had a lot of success in the martial arts really young. Actually, I started martial arts, sport karate, essentially, at age 4. And in the 90s, I got to work with some of the biggest names in the karate world, in the martial arts world. I worked with Grandmaster Jerry Fastby Fontanez as my primary instructor. I worked with Billy Blanks, who was famous for Tai Bo. I worked with Ernie Reyes Jr. and a lot of people that did a lot of Hollywood martial arts as well. Bill Superfoot Wallace. And I got to get trained under like some of the biggest names in that sport/discipline, really from a really young age. And it was because of the martial arts that I started to get a passion for teaching in general. I became a head instructor in a martial arts dojo at a really young age, at age 12. I was competing with adults and then teaching classes 6 days a week right after school in the evenings. And it was because of that I really, started to see how much I really enjoyed teaching, particularly youngsters, and getting like as you said earlier, like kind of the next generation of people to excel in something that, you were proficient at. As time went on and, graduated high school and getting into college, it was always on my mind that, well, you really love teaching. You've been teaching martial arts. You've been dabbling here and there, running summer theater camps and things for kids. You're going to essentially be a teacher. And this really weird epiphany moment came to me. I have never had what anyone would consider to be stage fright. I'm a pretty outspoken individual. I don't have difficulties with public speaking or that like. And what I found was I had anxiety over the stupidest thing in the world, honestly. And it was, I didn't think that if I was a teacher and I had a stack of papers, because we didn't all have tablets at this time, right? That we didn't have Chromebooks to teach on, that I would be able to separate the papers quick enough to hand them out to my students. I had anxiety over this ridiculous notion. At the time, to me, and this is what I say to patients that are suffering from any type of anxiety, right? At the time, as silly as a thing as it is, extrinsically to look at it from an outside perspective, when you're in those moments, those anxious moments, right? There can't be anything worse. And individual to individual, that impact's going to be different. But so I didn't think I could separate papers fast enough. And I said, well, how am I ever going to teach? And, I started speaking with other educational professionals and things like that. And I, as a kid, never had to go see the school psychologist for anything. I was fortunate in that regard. But I did have a few friends and acquaintances that, had some learning disabilities and things, had, through their CSEs, had IEPs developed and things like that. And so I knew the school psychologist existed. And I started thinking about that tied into the education of things. And I realized that it's so funny. What I wound up doing in graduate school and then becoming a certified school psychologist in the state of New York was learning how to teach people, right, coping strategies or strategies for those things that kind of give you setbacks in life and making those things easier. And, I just find it a full circle kind of funny thing that that anxiety that I had over something so minor changed my course in how I was going to approach education, ultimately how I was going to approach my career, but also full circle, I'd be teaching myself essentially, like, what could you do, Vin? Oh, you could hand it to a student in the class if you had that anxiety about not being able to separate those papers fast enough. You could, come up with different ways of getting those papers out, put them in groups, and the kids could come up to the desk and get them. And so all different strategies for getting around that hang up. And then I, proceeded to spend a career teaching these types of strategies to kids in different facets to get over whatever hangups they might have that were kind of impeding their overall educational and learning process. So that's how I got into school psychology. And then, wild, right?
Yeah. Well, I'm not to split hairs here, but you, as a youth, are sparring with guys who are probably twice your age, weight, and experience.
Yeah.
Like often getting kicked in the head, and somehow got up to do that every day, and then teach others to do it after school. But then something as minor as what you just described, handing out papers. I mean, so you developed coping strategies or ways to deal with it. I'm interested to know, did you ever get to the origin as to why you might think you would have that anxiety in the first place?
Jeremy, I think as I learned later in life, and, I kind of lean on the Howard Gardner idea of multiple intelligence in this way. I'm one of these kids that grew up, and anybody within earshot would hear me say when it came to school, and really applying to the discrepancy model of psychology overall, which is what I learned later in life, right? I suck at math, right? There was anxiety over things like math. And as time went on and I'd find myself in social situations with friends having to pay for a bill and realizing that I'm the one who's figuring out how to split that bill and things like that, I realized that, ultimately, I don't suck at math. I'm about average, maybe a little bit better at average in math. I'm a lot better at language. And so for me, that discrepancy was that, math is just not good. I personally suck at math. I never had a problem, like you said, getting up there and doing those things. I didn't have a problem performing on stages, public speaking. I performed with on and off Broadway with theater performers. A lot of those guys didn't have any of those problems. But for whatever it was there in me, I felt that there was this shortcoming, and it
Yeah.
may not have even been a shortcoming, right?
Interesting.
Um,
Interesting.
yeah,
Yeah. So full disclosure, I'm not a psychologist, but I mean, I'm sure I felt anxiety. I'm sure most people listening, I'm sure all people listening have felt anxiety. And, I've worked with a lot of high performers, who are athletes, a lot of high performers who are entrepreneurs, and in a role of coach. And when you're in that universal role of coach, you're really kind of a generalist, right? And so, a little bit about everything, enough to be dangerous, so to speak, but then, also enough to know when to hand off to bring in the right experts at the right time. But on the topic of this performance anxiety, and again, I'm not trying to psychoanalyze you to death. I'm just genuinely interested in it.
sure.
Is there a discrepancy in, how we can perceive ourselves as, say, you're a champion martial artist who's again, succeeding at guys twice his age, weight, experience, performing on Broadway, but it's like, seriously, like I can't do this menial task. Like, is it something that exposes our humanity, our humility, if you will? And is that sometimes too hard for us to deal with? Like, have we built ourselves up so high?
Right.
Uh, um,
I'd
yeah.
say it does. I think there's that component that sometimes those counterbalances are good in life, right? They keep us a little bit
Right.
more grounded,
Right. Mm.
They keep you in tune with the idea that we're not perfect beings. We're not supposed
Hmm.
to be, and that's okay.
Right. Right.
And that's part of the coping mechanism that we then try and teach with regards to anxiety.
Mhm. Yeah.
It's important to note, right, that for every person, every experience is going to be different. You're going to have the person whose pain tolerance is that they get kicked in the head and they're okay the next day about it, right? And you have the
Yeah.
person that stubs their toe and they've got their foot up for days on end. And what I say to those individuals is it's okay, right? Because that's your experience, right? Trying to take away from that overall experience and the way somebody feels, we're not doing somebody justice that way. Teaching
Hmm.
the coping mechanism to get by whatever your hurdle is more
Hmm.
important, I find.
Hmm. So you spent a couple of decades in, what was it? What level of education was it? High school?
Oh, as a school psychologist, so I started my career as a school psychologist with oppositionally defiant students, from low socioeconomic backgrounds, with gang affiliations, in a school that specialized in ODD kids, all the way from our youngest students were seventh graders, and we went all the way up through New York State special educational law, age 21.
Okay.
Uh, I became a psychologist at 23. Got my feet wet stepping into one of what many consider the most difficult populations to deal with. And my oldest students, my first year, were 19 going on 20.
Wow.
Yeah, it was wild. It was, there was no textbooks and professors that prepared you for that.
Right.
That is the type of infield learning that, I still hold really dear. It really did help form my vision for best practice and where to go from there with regards to things. I
Mm.
don't think there was any other way to learn
Mm.
the things I learned than that way. The most important tool that I did learn was irreverence at the time. If you don't mind, I'll give an anecdote about
Yeah,
this.
please. Please.
Yeah.
Yeah.
So we've got these really tough, really rugged, rough kids, right? Many of which coming from broken homes, many of which are out, buying firearms illegally, literally bringing them back to campus. We had a lot of lockdowns for these types of things. Many of which, are constantly getting in fights, stealing, doing whatever it was that they felt they needed to do to survive. And I'd been there for roughly 2 months. It's my second month as a psychologist, real close in age to some of these guys. And, it's hard to, first of all, garner that respect from someone who's so close to your age, right? But also for them to see the humanity, that human connection, right? It's really important to make these connections. And we had a week at that time where every other word out of some administrator or teacher's mouth was, we need another functional behavioral assessment. We need another strategy for this. We need a behavior intervention plan written again. And I'll be very honest with you, a lot of these behavior intervention plans, functional behavioral assessments that lead to these behavior intervention plans wound up being just words on paper, right? The follow through was never such that it was impactful.
Mm-hmm.
And we had tons of fights that whole week. We had classrooms with, and we weren't getting tons of funding. It was privatized, broken desks and not much materials in the ways of paper left and things of that nature. And so I take with me, just this thing dawns on me. I've got to do something a little different. And I grabbed two of my favorite support staff members. So those are individuals trained in therapeutic restraint holds and de-escalation techniques and the like. And we get up to this classroom, and I've got 3 or 4 of these young guys in there, and they're sitting. They don't have, a book to speak of or anything like that. They're just sitting there, and they've got one is listening to his iPod at the time, and there's no engagement in learning. And I look at the teacher and I said, I know you want me here. You can stay, or you can go, but the phrase we used, I was like, it's going to get lit. It's going to get lit in a second. And so my support staff members, they close the door. We close the door. I go in. The first thing I do, I walk up to one of the desks, and this is irreverence sometimes at its best. And I take the desk in front of the kid and I flip it over. And then I take a chair and I throw it across the room. And I have what I would consider a full-blown tantrum. And the support staff members are there. And you would think that these hard kids that are always seeing all this stuff, and we've always got all these violent outbursts and things, which, again, they're 17, but the outbursts we're seeing are really that of, toddlers throwing tantrums. Honestly, it's the same need for that attention, right? Negative or positive, as long as that attention's being given. You would think that they were going to do something. And all they did was they just sat there, their mouths dropped, and they just looked at me. Didn't say a word. We've left the room now in shambles. Okay. I don't say anything to them. I turn around. We walk back to the door, get my hand on the door, turn the door. I'm about to leave. And I look back and I go, and that's how stupid you guys look when you do it. That's how stupid you look. And for the next couple of weeks, we had a reduction in write-ups. We had a reduction in fights in the hall. We had a reduction in breaking things in the classroom. And we had a significant reduction, which for me was a great time saver and less of waste of time, in that I didn't have to write that many FBAs or BIPs for the next couple of weeks. Irreverence was key. It was key in a lot of ways. It was key in that population for me to teach a kickboxing class, right? It was key to garner that respect from the kids and making those connections by doing something just a little bit outside of the box. Nothing that I had learned in programs that taught me, somebody feels this way and you ask them this question. And then the next step is the tree goes this way. Do you pick this one or this one? None of those things mattered when I got into these programs. It was always just doing something a little different. And so, after that, as my career progressed, I was always just trying to chase the next thing that is the next edge. What's the next cutting edge thing that helps that get better? How do I address this person in a way that might not be the most common way of doing it? Because if the common ways that we always do things work best, right, then there would be no need for alternative ways of doing things. And at this point in my career, I've always found the alternative, the non-mainstay things, to be the most successful. So I did, about 8 years as a school psychologist with ODD kids, and I loved it. And I was living really far from the school I worked in, and the travel was 120 miles a day in travel, and it started to get the better of me. And so after 8 years there, I decided to move into somewhere a little bit closer to home. I ultimately wound up at another specialized program through what we call in New York State, the BOCES programs. I have never worked in my career in a typical normalized school. I've never worked in a non-specialized classroom. The last 7 years of my career as a school psychologist, I spent working with kids. There was some oppositional defiant kids, but for the most parts, the kids that I found myself specializing in were attention deficit and even more so spectrum disorders. I don't use the word autism lightly because I don't view autism as the what is typically referred to as autism, which is it's this disorder that is on a spectrum. And when we talk about spectrum, we're talking about spectrum of degree. I don't see it that way. I see it as a disorder of spectrums, meaning multiple disorders that have some commonalities in their external presentation. And so, I spent 7 years in this school system, working with kids as young as, for a while, I did 2 years in kindergarten through grade 2, which was great. And then I did several years in that middle school, 5th grade through 8th grade realm as well. And I started learning and seeing that different strategies that would work for one subset of kids wasn't working as well for other subsets. And again, I was like, I've got to come up with different ways. So I started doing some more outside of the box thinking, and I started doing a lot more research in peer-reviewed studies. And the key thing that I will say with regards to that world of spectrum, and I want to speak kind of to spectrum parents who are dealing with children on the spectrum. And I want to say to them that when you are looking for alternative styles of treatment for your child, going down the rabbit hole of studying everything that is listed with that big word, that autism word, is going to do a few things. One, it's going to be extremely overwhelming, right? And two, it's not going to lead you on many successful paths. And the reason for that is that when studies are done, even the best of studies, peer-reviewed studies, with regards to autism, we're taking a giant subset of people who have some commonalities in external presentation, right? And we're providing whatever that therapy that we're trialing may be to groups of people who may have similar comorbidities, but the core of the reason for those comorbidities is not the same. And so most studies that we see with that label, that autism label, are typically found, especially alternative studies, typically found to be unsuccessful, even when it's trialing different medications off label. And that's but you'll see within those studies that sometimes you'll get like 3% of the people that trial this medication seem to do well, right? So it's always hard to pick through what's the commonality in those people. We serve people a lot better when we're able to bring them down into these smaller subgroups. Obviously, and I think you can attest to this, Jeremy, I think where things are headed as technology advances and things like that is this personalized medicine that we hear a little bit more about nowadays, right? And that's driven directly off that individual, their purposeful needs. But we're not there yet. So what we try and do is shrink this spectrum of people, this giant group, and get them into smaller subgroups. And what we find is we have more success that way in treating by subgroup, right? So, what I would say to autism parents is look more at the external presenting things that you see, that you notice in your child, and look at studies that lend themselves to those particular externalized things. We're treating inattentiveness, not autism. We're treating inattentiveness. This study treated inattentiveness through use of this protocol or through use of this medication or this supplement, whatever it may be. The success is there. You got to break things down. Things get too broad and they get too far away from us too quickly.
Right. Well, it's interesting. You point to the classification system, right? And it's at, what level is there a level of irreducible complexity? And what I mean by that is, broadly speaking, we have genetic determinism, environmental determinism, and call it behavioral determinism. Mm-hmm. If you believe in determinism. I think certain things, all else equal, are going to affect an outcome of an individual. So for example, you talk about, low income children challenged under low income households, and probably struggling at home for attention from their parents, and that manifests in the, the school. And so it might not be fair to say, well, they're genetically predisposed to those outbursts. Now, there could be some aspects genetically that might exacerbate them, make them more vulnerable, more extreme, et cetera. And then it's like, well, the number of times that that kind of behavior has been reinforced is like, oh, is that now becoming a character effect? And, left unchecked randomly. I mean, I think, well, you're the psychologist, but we humans tend to run from pain and most of the time run from pain and maybe sometimes toward pleasure. But here you've got, up close and personal into, a developing mind in, perhaps the more challenging situations. And now you fast forward the work that you're doing at Gray Matters, for example, and it's beyond autism, it's beyond ADHD, it's beyond other cognitive challenge per se, because if I check out what you guys do, there's a list of states, let's say ADHD, anxiety, autism, concussion, depression, long COVID, migraines, PTSD, and CPTSD, as well as sleep issues. And so I'm interested to know, what kind of, to the extent that you can share, what kind of clients, do you serve today? I mean, let's talk a little bit, obviously, about, the neurofeedback practices that you implement, and this whole idea of brain mapping as well, because it kind of seems to me like how I understand, psychology and call it therapy. Well, first of all, hopefully that there's the stigmatization of it is changing, because I mean, what I can share like from personal experience and overcoming tragedies like losing a parent, losing a loved one, getting ahead of or getting assistance with that grieving process and everything left unsaid that accompanies that it is hard work to do on your own. And oftentimes it's the paradigm shift that's hard to come from the inside out. And where one of the things that I've learned, say personally and with the entrepreneurs I'm working with, is sometimes it's the way we see the problem is the problem, right? And so, but if you're stuck in, say, a negative feedback loop, how do you overcome that? And so when you talk about neurofeedback, when you talk about imagery, to me, it seems like you've got, tools and a way of mapping that, seems to be more objective. Because I think, again, my understanding of psychologists and what psychologists do is there's part science, but there's, art form, like throwing desks and breaking chairs is probably not in the practice manual. So,
no,
so how are you taking these like next generation tools,
right?
And what kind of folks are you seeing? What kind of results are you getting?
Right. Well, right now in my clinic in Greenwich, Connecticut, so we have two. We have the Westport location and the Greenwich, Connecticut location. I am the clinical director here in Greenwich. I've got everybody from 2.5 to 77 in clinic right now. And and we've got everything from ASD and ADHD all the way through to bipolar disorder. I treat a lot of concussion patients as well. Actually just did a concussion analysis yesterday for a patient who will be starting treatment later on this week. And, her prognosis is a really good one. We got her here early enough, and I think she's going to do really well. There's this subjectivity is what you're referring to with regards to mental health and psychology. And my ultimate goal, we really hope to change it. We want more objective, right? I tell prospective patients when they call, I say, listen, a lot of things can look the same on the outside, but it doesn't mean it's the same thing going on inside, right? I would not go to my GP with a sore throat and have them shine a light in my throat and see it was red and say, oh, you've got strep, I'm going to give you antibiotics. I'd put pause on that very quickly. Antibiotics can be dangerous, first off. And secondly, right, I know that there's a diagnostic tool to use, right? You do a throat culture. My understanding, you will probably know better than me. My understanding from friends is that a throat culture is about 70% accurate, 70 somewhat percent valid, typically, which makes it a good test. We have a diagnostic tool in quantitative EEG. It is showing us the electrochemical functioning of the brain. It is showing us in hertz, measured in hertz, all of the brainwave activity that is occurring. And we utilize something called SW Loretta, which is the most advanced form of collection and interpretation of that data the world over right now. And that allows us to not just see power deficits and or excesses of power in each of the wave bands going from delta all the way through high beta, but it also allows us to see things like connectivity, coherence, how similar or dissimilar areas of the brain are acting, how well they're doing their specific jobs, meaning our prefrontal cortex is certainly doing executive functioning well enough, and our amygdala is doing that autonomous fear response, and the amygdala is not thinking it should be doing the job of the prefrontal cortex. Those are the kinds of things we look at. We look at phase, how quickly or slowly information passes to and from different areas of the brain. And then we're able to create these really fingerprinted, customized protocols to address the specific needs of the individual. I say that they're very fingerprinted and customized. I mean, I've mapped identical twins with similar externalizing things, and their brain mappings were not the same. Their protocol is not the same. So it is that very individualized. And the reason I came here to Gray Matters, and the reason I am no longer just a school-based psychologist, has to do a lot with subjectivity. It has to do with things I was seeing in my private practice. We had this global pandemic. We were on pause from schools. Kids that are already struggling with social skills, right? Were certainly going to take a big hit during the pandemic, being locked in their homes. It didn't matter what strategies I implemented, what cool videos I made for them, how many times we did counseling and things like that. There was going to be a hit taken to progress we had made. During that, I actually happened to have my kids during the pandemic. Mine are 4 and 3 right now.
Wow.
And we got back to schools, and we told everybody that was over, but nobody told the kids, right? Nobody told the students. They didn't know it was over because they had no idea what to do anymore. They had no idea as far as structure and following routine and how to socialize, and things had gotten worse. And then in private practice, where I had been, subsidizing what I was doing and doing private practice and doing executive functioning coaching with kids, play therapy with kids, I was starting to notice a trend. And the trend was that my private practice changed. I wasn't able to treat anymore. What my private practice became was parent advocacy. Parent advocacy for going to CSE meetings on parents' behalf, because schools took this turn where they weren't working with parents anymore. They were kind of telling parents what needed to be done with their kid. And it was problematic for me, right? Being a new parent, I always had a passion about working with kids, that next generation, getting the best out of people, early intervention for those things. And then I became a parent. Jeremy, you're a parent?
I'm a parent. Yeah.
So
I have a daughter. Will be a year next month.
Oh, God bless you, man. That's wonderful. So you can probably say this without question, that you become a parent and it changes you. It really does. It doesn't matter how passionate I was about working with kids before. That is 1 million fold at this point, once my child came, right? And so I looked at my wife at that time. I had been already delving into the world of neurofeedback, had already been in touch with Anthony Silver, because I didn't want to just learn the basics of something. I wanted to go to the best people and learn it. And he was gracious enough to take me under his wing and start teaching me the principles of neurofeedback. And I had started trying to apply it into my private practice, and then that got shut down. Essentially, I'm doing all this parent advocacy. Schools are telling parents, with no one available or having the ability to diagnose, telling parents, your kid has ADHD. They need Ritalin. They need Adderall. And so parents are in this panic. Kids are being overprescribed a lot of the medications very quickly. And I look at my wife and I say, if it was ours, I'd want somebody to do something different. I wouldn't be okay with it. And so, Anthony was, gracious enough to offer me to come aboard and direct here in the Greenwich office. And I jumped at the chance to do it. I will say that with regards to ADHD, if we're just looking at ADHD, Jeremy, out of every 10 kids that I get here with a previous ADHD diagnosis, if I'm being very kind about it, 70% of them, 7 out of those 10 kids, their parents leave here knowing that stimulant medication is not going to benefit their child, not by that brain pattern. A classic ADHD brain pattern lets us know that there is what we call cortical slowing. There is too many of those slow brain waves in the prefrontal cortex. And that leads to dysregulation in executive functioning skills. That leads to individuals that can't sit still and maintain attention. And stimulant medication benefits that in that it increases arousal, right? And so those kids with classic ADHD will see that benefit. A lot of the kids we get actually have more of an anxiety-based profile. They don't have cortical slowing. They have excess. They have hyperactive brain. They have excess, faster brain waves, beta waves, high beta waves. And not in their prefrontal cortexes typically. They typically have this over-aroused profile in their thalamus and their posterior cingulate, areas that are really in charge of regulating emotion. Now, extrinsically, right, those things look the same. So in no way do I say that the psychologist or the psychiatrist or whoever it was that gave that initial diagnosis did anything wrong. They did everything that they were taught to do in the way they know how to do it. And unfortunately, the DSM gives us a lot of gray area and subjectivity, because I can look at a kid and say, they're sitting well enough. And maybe, Jeremy, you look at the kid and you go, no, they're bouncing off the wall. They're not sitting well enough, right? And we can have that discourse about the 5-year-old. But when I look at their brain pattern and I know that they've got too many high beta waves in their posterior cingulate, I know for certain that giving them a stimulant is only going to exacerbate that. It's going to increase those. And that's already the root cause of their problem. And those things look alike. Having cortical slowing in your prefrontal cortex and having over-arousal in your posterior cingulate externally often look the same. Looks like someone who can't sit still, fidgets a lot, can't focus. And so that ADHD diagnosis happens quick. The problem is that the go-to for that diagnosis is that medication. And that medication isn't always going to be beneficial. Sometimes it's going to exacerbate that externalized thing. And so really getting in this field and getting to do this was about taking subjectivity out of the equation and being more objective in my approach with how to treat. We really do here at Gray Matters, we specialize in quantitative EEG analysis, functional brain mapping, and neurofeedback therapy. And those are our primary diagnostic and treatment tools, but they are not the only treatment modality I offer here. Particularly because I don't believe in a singular treatment modality for anything in this world. Some people get headaches; they're okay with acetaminophen and Tylenol, right? And some people need an NSAID for it, and some people that NSAID is going to be ibuprofen, and some people it's going to be naproxen, and some people that headache's actually due to allergens, and they need an antihistamine, and they need an H1 antagonist, and some people need a new gen antihistamine for that, right? And some people just need the fresh air. So I don't believe in singular approaches to anything. So we have also tried to diversify that in a lot of ways. We offer photobiomodulation as an add-on therapy to a lot of our neurofeedback therapy, and only when it's warranted based off that individual's brain profile. So some people will come and say, oh, and I want the red light. And I'll say, I don't think the red light's going to help you, And some people I will say, you're coming 3 days a week, and I think that the red light's going to help you. It's going to help you one session a week. Pair it with one of the sessions a week. I think more of that is just too much, right? And some people I say, you should do it 3 times a week. So we do this very holistic approach, and I am firm on that WH, that whole part of the holistic, where I am looking at all the things I would have looked at when I was doing things subjectively. I'm looking at social histories, medical histories, symptoms of complaint, and observations I make during my clinical interview with somebody. And then I am pairing it with the analysis that I'm able to garner from that quantitative EEG recording of their brain. And then we get to paint this whole picture of what somebody looks like. Another thing that I'm excited to say that we have most recently added is we are also doing blood draws for micronutrient deficiencies. And that was something I found to be really important just in all the deep diving and all the work I've done within the spectrum disorders, because there is a particular subset of kids that we have found that are deficient in a lot of micronutrients. And in boosting those things, we find a lot of really great improvements in things like communication, in things like socialization, eye contact improves, and things of that nature. So it was something that was really important to me to also bring here and start pairing with our primary modalities. And we've had some really great success.
And you guys are even taking it to the next level with DNA analysis. Is that right?
We are, yeah. Well,
Yeah.
that's all, thanks to getting to hang out with and meet you. And I hope to learn a lot more. I'm quite the novice yet, but certain subsets, certain biomarkers that I do know about are really helpful, because it helps me in that initial treatment approach, right? If I know that it's somebody that has a certain biomarker that speaks to mitochondrial deficiencies, then there's going to be certain things that I'm going to give. I'm going to give carnitine. I'm going to give, certain recommendations, alpha lipoic acid and things of that nature built into a nutrient protocol that we know CoQ10 is going to really benefit those people. And it's important to be able to look at those things.
Yeah. I mean, it is, I want to talk a little bit about the DNA, but I just want to make sure that I understand, and actually everybody listening understands, what exactly neurofeedback is. I think we talked around different modalities.
Yeah.
Yeah. So could we
Absolutely.
Yeah.
Neurofeedback therapy is wonderful in that it makes something way more real than I ever observed it to be prior. So in psychology, we talk about positive reinforcement, and it's this really, really important tool. And positive reinforcement's great. And forever as a psychologist, particularly when I was in schools, we're utilizing positive reinforcement. A great way to use it is, let's talk about the kid anecdotally that can't sit still for more than 15 minutes in class. And the teacher wants us to come up with a reward system chart for that kid. Our goal is to get them to sit for 15 minutes at a time. And I would do this for 30 students over the course of a school year, right? And I would find that, they get a sticker on the chart, a sticker on the chart, a sticker on the chart when they did their 15 minutes, and then they get their big reward. And it's something tangible that we know that kid wants, right? And I was finding that I did 30 kids, and of those 30, 7 of them did really well that year. And everybody would be like, well, that's great. We did really well with 7. And I go, but positive reinforcement is so powerful. And I know that kid wants that. So why isn't it working? And in understanding QEEGs and understanding brain mapping and understanding neurofeedback, I understand that you can't will away. You can't just say, I want that so I can. Sometimes it's not always mind over matter. Sometimes there's something there really causing that block. That kid really can't sit still. So neurofeedback therapy uses positive reinforcement. But what I say to people, what I say to parents most regularly is, we cut out the middleman. We cut out the middleman of extraneous behavior. Your kid doesn't have to do this cognizantly. We reward the brain for acting more efficiently. In the case of, let's say, classic ADHD, and we don't want to treat with a stimulant medication, they have that cortical slowing in the prefrontal cortex. That means they have too much theta up here. We want to reduce that. And so when an individual is coming in and sitting in, we've got these really cool private movie theaters here. They're these soundproof booths. They've got burgundy carpeted walls like a movie theater, and they got a big old screen. And our patients sit and they wear an EEG cap, and they watch what they want to watch for 45 minutes. While they're watching that, we're going to stay within the parameters of their individualized protocol. So let's say that kid's got too much prefrontal theta. They've got ADHD. Every time their brain is producing that excess theta in their prefrontal lobe, the video they're watching dims and the audio gets quieter. And the only way for that video to increase in brightness and volume is for the brain to do what the brain does really well, honestly. It's doing so many things all the time, things that we don't know it's doing, right? Is it starts searching signals. When it has reduced the amount of theta back to a more normative level in that prefrontal cortex, the video increases in brightness and in volume. It is positive reinforcement, cutting out the you must do and rewarding your brain for doing what it should do. And as time goes on, the brain retrains itself, is what we say. to function more efficiently. We've got this 3-pound organ in charge of all this stuff, and sometimes it loses its way. It's burning tons of energy all the time, and it can't do so. It can't burn energy efficiently. So we're retraining the brain to act more efficiently. The byproduct of all of this, the re-regulation of the brain, the byproduct is the elimination, ultimately, certainly the reduction of these extraneous unwanted symptoms. That's how neurofeedback therapy works.
Yeah, that's very clear and amazing that you can make it objective, right?
That's the goal.
Um,
Yep.
mm-hmm, mm-hmm. The DNA side of things, you know what I was thinking would be a great jumping off point for you guys is to check out some of the work that Dr. Actually had him on my show recently, Dr. Ben, give me a sec here, author of the book Dirty Genes. Yeah, Dr. Ben Lynch. So he dives into, specific culprits, let's call them dirty genes, and the epigenetics thereof. So things like your MTHFR or COMT. I mean, these are highly dialed into cognition. Of course, there's a whole discipline in this area, cognitive DNA, let's say. And, you as a clinician, but also as a researcher, as I've understand it, the tools that exist now to understand genetics and genomics being the whole genome, not just single genes, like how, essentially you're looking at, multiple markers, or even how multiple markers come together, polygenic, if you will, and to start to see where where is the field currently in terms of, what genetic markers might you start to look at a priori with your client base, but then what you also might learn just by having access to the data and partnering with universities, for example, because you can now access this whole genome sequence data for hundreds of dollars instead of millions of dollars. And now, you guys are in conversation with sequencing.com. It's not just that sequencing is so cheap. It's that actually there's tools to now analyze it. So I think about, again, there are things that you want to know a priori. You talked about mitochondrial function. So it's hey, let me scan, what are the mitochondrial genes that I'm looking at in particular? It's hard to get that kind of information out of standardized tests that are, recommended by your specialist because they're looking for a certain thing, right? You're kind of doing more like hypothesis outcome type of work, if you will, because you can look at the entire array of DNA information as it relates to pathogenic markers, but maybe there are even some non-pathogenic markers, and depending on the variant you have, that does, correlate with, increased negative reactions with a particular state of ADHD. I mean, I don't want to pretend that the solutions are here today, but I would suspect in the next 5 to 10 years, the kind of studies that you would be able to do, given the cohorts that you are researched with previously and are continually working with, I think the genetics piece is becoming more accessible, right? That's one of the things that, my struggle with DNA was, having actually been a founder of a previous venture focused on performance DNA and performance DNA specifically of athletes trying to win medals. You can look at all kinds of things like micronutrient predispositions for micronutrient deficiencies, but if that's tackled, that doesn't need to be discussed, right? It does need to be discussed if you are, let's just say, unconscious of your nutrition. But generally, high performance athletes, they're not having an issue with B vitamins because they've got a nutritionist, they've got somebody helping them. But that being said, when you start to get into instances of higher output, you might actually start to see some of the, byproducts of deficiencies, like, for example, decreased mood during increased exertion, right? And so you can actually develop, and we have developed cocktails for athletes that are actually based on their micronutrient profiles that, seem to have, beneficial effects in terms of cognition, in terms of injury avoidance and recovery. But, it's very early days. We call it evidence-based. You don't have these massive cohorts like, we did, for example, from World War II, where you get to study nutrient deficiencies as evidenced by, consuming a diet of processed foods for prolonged periods of time. And then you start to see things like, rickets or scurvy. And so that's
Right.
how you get to the RDAs of, the recommended daily allowances of different vitamins and minerals that we see on food labels today, which, we know are, I suppose they're better than nothing, but they're mostly based on young men who were deficient as a result of their career.
Right.
So the fact that we can start to track many things, not least of all like the brain imaging, but then that paired with genetics, and then that paired with treatment outcomes, and then that kind of all wrapped around, an AI that includes your comprehensive electronic medical health record, you can really start to have a conversation with like the digital patient, and then you can start to have a conversation with cohorts of patients, and then you can start to, transect those audiences to start to actually look to see the generalizations. But I like going back to like what you had said at the beginning. It's like, well, usually we cluster things, or we segment things down to groups, but it's hard to say where is the irreducible complexity? Like when do we stop seeing signal, and when is it all noise, or what aspects of these groups are artifacts? So I just kind of danced around a few things there, but I think the theme is coming back to, I think, your passion for joining Gray Matters. That's the objectivity. That is the quantified self, right? So having that DNA at the center seems to me like it's a critically important aspect of what you guys are going to do in light of everything you've been doing for decades.
Absolutely.
Yeah. Yeah. So what's the future of Gray Matters? Like what's on your map for the next like 3 to 5 years?
Yeah. So something that I've done a recent deep dive with, and spoken with a few nootropics experts on, actually, involves looking at and we're only going with naturally derived supplementation at this point, only because people get almost scared by compounded things, even though, and I joke about this often. I say, like a statin is naturally derived and NAC is not. And you need a script for that statin, but you don't need it for that NAC, right? So it's interesting. But we naturally derived supplements, vitamins and or minerals, and nootropic in nature, that through study we have looked at which ones increase and or decrease each of the wavelengths that we are looking at in quantitative EEG.
Oh,
So
wow.
what increases or decreases delta, what increases or decreases theta, and all the way through high beta. We don't really touch gamma here. It's not something that we train regularly at all. But right now we're looking to do those because while we're doing our micronutrient deficiencies and creating customized supplements for patients every month, it would be nice to know that if you had a profile that had a deficit in alpha, that you can increase that with, whatever that appropriate supplement would be. I think it's L-theanine actually is the one we've been targeting most recently, gives us increase in alpha. And so when we create their customized supplement, we add the appropriate dosage of L-theanine to that supplement. And what we have been finding, pairing that with a little photobiomodulation as well prior to neurofeedback session, is that neurofeedback goes a little bit smoother and we get even better outcomes than we had already had. So that's something we've been targeting most recently. And the other thing that we're hoping to look at, and I think our founder would be better to speak on this, is just changing psychiatry in general, meaning taking that subjectivity out of that. And the way of doing that is pairing that quantitative EEG in a lot of ways and looking at medication response based off of brain function, and how not just the genetics of it, but rather that QEEG activity, what that says about medication responses to psychotropic medications and the like.
Amazing. Vincenzo, when we started our conversation, I asked you 3 things before we started.
Yeah.
And I want to just kind of revisit those now. I think I could probably guess, well, at least the answer to 2. But the 3 questions were, if this was your last podcast, what would you want to say to the world? And specifically number 2 is, who's the one person that you hope this message would reach? And then the third thing is, which person would you nominate to be on the DNA of things?
Absolutely. Okay. So if it was my last podcast, The thing I would want to say to the world is there's no silver bullets in treatment for any ailment in this world. And so don't give up, right? If something doesn't go the way it went, a treatment doesn't go the way it went for 5 other people that you know that received that treatment, it doesn't mean it's the end of the road for you, right?
Yeah.
There's always a new avenue to explore. There's no silver bullet, and unfortunately, there's a lot of trial and error in this world. But the more we learn, the further we push along, the further we push those barriers, and the more technology that we get at our disposal for the betterment of people, the easier those diagnoses and those treatments will become, I hope. The people I really want to hear that right now. I think you know where I'm going with this one, Jeremy, is I want all the parents to hear it because I want your kids to do well. I am very much about the continuation of humanity and the next generation doing better than the last. I feel that if technology and medical sciences and our knowledge base continues to grow, then each subsequent generation should be better and better. And I feel that we've had all this stuff growing and growing, and I feel there's been like a little bit of stagnation there. Just a little bit of a fear response to a lot going on around us. So I'm speaking directly to the parents. Explore all avenues for your children. You know your child better than anyone else in this world, and do not give up hope when you hit any roadblock. Continue to push and find what's right to treat your kid in the best capacity you know how. Okay. As far as somebody that I would like to recommend you have on the show, it's pretty easy for me. The founder of Gray Matters, Mr. Anthony Silver, is one of the foremost experts in quantitative EEG analysis, functional brain mapping, and neurofeedback therapy. Don't know if he's going to watch, but if he's watching, I don't want the head to get too big. I want you to be able to come into the Greenwich office and get through the door. But I admire you. And I thank you very much for the opportunities you've given me to grow and continue on the path that I am professionally. And I am very pleased to be a part of, some of the wonderful things that we've been able to do. Jeremy, thank you so much for having me today.
My pleasure, Vincenzo. It is an enlightening conversation, as I thought it would be from our first introduction. So, thank you so much for all that you've done, all that you're doing, and for taking the time to share your journey with our audience. Vincenzo, it's been an absolute pleasure.
Been an absolute pleasure, sir. I look forward to speaking with you again in the near future. Yeah.
What an empowering conversation with Vincenzo Fata. Today, we explored how the combinations of genetics, environment, and behavior gives us the power to change our mental health outcomes. Vincenzo's commitment to personalized brain mapping and neurofeedback highlights the incredible potential we all have to rewrite our stories, whether it's overcoming ADHD, anxiety, or other cognitive challenges. His work is a reminder that there's no one-size-fits-all solution. Only approaches that consider the unique makeup of each individual can truly lead to transformation. So that is one size fits one. If you found today's conversation inspiring, or if it opened your eyes to new possibilities for yourself or someone you love, please share the episode. Together, we can help more people understand the power they have to shape their own lives through both the science of DNA and the choices we make every day. Thank you for joining us on the DNA of Things. Stay tuned for more stories of empowerment and discovery.